My name is Temilola Lua Daramola, but I go by Temi for short. I am a fourth year medical student at Drexel University College of Medicine, so I will be graduating this year, actually in a couple of months. I'm very excited about that. So I actually have more of a nursing background. I actually went to the Ohio State University for my nursing education. And while I was in nursing school, I actually had some early interest in medicine. Just took a little bit longer for me to get there. I wanted to make sure that I was really, really set for medical school. So I actually did Drexel's post-bac program, which provided a medical school linkage. I loved it. I was like, well, I'm about to be here for another 4 years. So yes, so that's how I ended up enrolling in Drexel University College of Medicine, and no regrets ever since. Coming into my third year, I knew I didn't want to move around. I knew I wanted to be at an all-year site. I also knew I wanted to be decently close to Philly, so not too far, but also not too super close. So basically, that was one of the reasons why I chose Reading. I actually had a friend of mine that had done summer research there, and she raved about how amazing the teaching environment is there, and also just how the residents are super amazing and just very hands-on. And so for me, that was really the biggest draw towards going to Reading. And so once I got to Reading Hospital, she basically affirmed many of what she said. Once I got there, I was like, oh wow, not only is this facility amazing, really, really awesome, but the fact that they were just teaching was just a part of what they did. It was just a thing that was so ingrained into the culture that I would say that was probably the biggest thing that really, really surprised me. One of the other things that they also did, which I loved, was about twice a week, we would actually go through different clinical scenarios in a conference room, and just problem solve through those cases. How would you manage this patient, and why is this management important versus this other management? So it really helped with expanding my clinical knowledge. And so that would be a good example of what I mean by their teaching culture. So for me, even stepping into the rain exam that we had for that rotation, I didn't really have to use any other resources besides what I had learned on the ward, which is pretty amazing because you don't get that in many places. There's a nice food scene there too as well. So there's definitely something to keep you busy. They have this arcade center that has different activities from laser tag to axe throwing. It's literally a huge building that just has a bunch of stuff in it. So that was a blast because I checked it out too as well. So there's definitely, like I said, there's definitely stuff to do there. I would definitely say, in terms of, students, in terms of the new campus that is opening at Reading, I definitely think it's a huge plus. I say that in the sense that I think it's going to build that more academic relationship between Reading and Drexel. Because right now, like I said, Reading Hospital it's more of a community hospital with a very strong teaching culture, but in terms of research opportunities and stuff like that, they do have a little bit of that, but I think Drexel is only going to help to expand and build that up more. I definitely just think it's going to strengthen, what Reading already has and what Drexel is bringing to the table in terms of the wealth of medical students, the wealth of academics, and just, really elevating the hospital to newer heights, and even Drexel as well to newer heights.